This video will discuss dispensing a post-op shoe for a patient or a Darko offloading shoe for the front of the foot. The post-op shoe is the most common thing we'll dispense. We'll dispense this for things like surgery or foot fractures or toe fractures. And very simply, you know, if the patient's had an injury, they can wear their sock, obviously, but if it's been a surgery, they're going to have a bandage on. They'd be barefoot in that case, obviously. And you're going to slide their heel all the way into the back, and you'll tighten the straps here, just as so. And then once you do that, you're going to have the patient step on the floor. So you can stay on the floor for me. You can turn that way. So we're going to make sure that that shoe is giving them plenty of space at their toe, so there's not, they're not hanging over the front. I wouldn't make more than 2 finger breadths of distance away from the tip. That means you need to go the next size down, obviously, if they're really far back in that. But that's how you apply that. And once they step on the floor, this is important. You should really re-tighten it then, because it does change how tight it is. Now, for those patients that have sores in the front of their foot or an injury to the front of their foot, you can come on and have a seat again. There's this guy here. This is called an offloading shoe. It applies in the same exact manner. The difference is that when they walk, if they allow themselves to walk normally, they'll kind of feel uncomfortable. This forces them to walk on their heels, so it reduces the pressure on the front of their foot. Okay? And that's the post-op shoe and offloading shoe.